Welcome to the first recorded Executive Cabinet Member meeting for adults and health and wellbeing. So welcome to everyone and to anyone who's watching. It's the 24th of August and it's a 12:30 meeting, and it's a one-item meeting. As you'll see from it, it's about the rationale, if you like, for establishing a dedicated leadership team for our newly formed 6 health and care neighbourhoods. We're on a journey to further integration of health and social care, which is about improving the outcomes for our residents who need these services. And this report is about the role and the description of these 6 neighbourhood leader posts and the funding arrangements with our partners, which will be shared. Our other GM authorities partners have already had these posts established for some time. We've observed how the other authorities have delivered this agenda, and it's now felt necessary to drive the integration agenda and the improvement of population health and tackling health inequalities, and that we now need to strengthen this approach with these 6 posts. Now, I won't say any more. I know you've all had the report. Just the fact that we are being filmed, I wasn't quite sure whether Rachel wanted to add a little bit more as the officer who was written upon, and Rachel is our Director of Adult Social Care. Right, off you go, Rachel. Thank you.
Thank you, Chair. So as you said, before, you've got a report for approval in relation to the establishment of a number of leadership posts for neighbourhoods. These are integrated posts with our partners in the NHS, and the proposal is looking at bringing forward a future funding model for the 6 posts, which will be a triumvirate between the Council, Greater Manchester Integrated Care Board locality of Bolton, and Bolton NHS Foundation Trust. The report does go through a bit of the context in terms of the development of our neighbourhoods, and in October last year, we made the decision that trying to deliver on a 9 strategic footprint for neighbourhoods was too great, and we were struggling to have enough resources to go to that level. So we have reconfigured to 6 neighbourhoods, and one of the key elements that came up from all partners was this. The report that we've got before you is this is the missing link to really help us drive forward, that we were trying to do it within kind of existing leadership management roles across partners, and we've struggled to progress. And the report sets out in the case for the dedicated leadership kind of some of the struggles that we've had, and when we've done the benchmarking with other localities, they've clearly went for this model some years ago, and it has really paid off. So I think for us is this now is a key priority for us really to take our neighbourhoods forward. We do have neighbourhoods, but they're not progressing at the pace we would have wished them to. The report then sets out kind of the options that were considered by the Finance Committee under our Health and Care Partnership Board, who have endorsed option 1 for all partners to take through their equivalent agreements in terms of their committees. And the option 1 is that we are looking to establish 6 posts at what is the equivalent of a band 7 in the NHS or a council grade K within this, and put some wraparound support. The other kind of recommendation is that rather than looking at fixed term posts or 2-year posts, we look at permanent posts, because we have seen that we're going to need these in the long term, and we risk not being able to recruit or having instability if we don't look at permanent recruitment. Now, the funding arrangements in the report is quite unusual in terms of kind of how we are going about this in terms of permanent recruitment, and we're seeking permission for up to 6 posts within the council, and the other partners will be looking at that same decision too from the Foundation Trust, because we'll be the host employers. The reality is we wanted to not put any barriers in the way of people wanting to apply for the post who may wish to either be on council terms and conditions or NHS terms and conditions. So therefore, through the recruitment, the balance of how many posts the council will employ and how many the FT will employ at any one time will depend on the candidates coming forward, because we want the right person for these posts. So that's slightly unusual, but I think it's quite forward thinking in terms of us being flexible as a partnership. The risk share is the triumphant, as I said, from a financial perspective. The year one funding in section 7 is being funded from a transformation one-off pot of money that we still retain between us, that we've all contributed to, will see us through. The intention then is that we will not be increasing the overall headcount in organisations in the longer term, or the financial bottom line, and that through turnover, reviews, realignment, these will be part of the overall establishment, and they will be funded from existing resources in the longer term, and we're fairly confident of the ability to do that between organisations. So the report's there. I'm happy to take any questions, and seeking approval as per the report in terms of noting the rationale for the leadership posts, noting the year one funding, and approving the long-term funding arrangements to establish these posts. Thank you, Chair.
Okay, thank you, Rachel. I can see a hand up from Councillor Heslop. Do you want to ask? Yeah, I can't see if there's one from Andy or not. Have you got your hand up as well, Andy? Yeah, sorry, I could only see Councillor Heslop. Well, Councillor Heslop, do you like to go first?
Yes, thank you, Chair. There are a couple of points actually I wanted to give me some fuller understanding of the role of these 6 posts. When I presume that the borough has been geographically divided, perhaps around the is it the PCNs? Is it aligning with that? Maybe 6. So I presume in my neck of the woods, we've got one that covers Farnworth and possibly Kersley. Well, I hope it includes Kersley, unless Kersley's got its own. But I want in the report, it suggests to me that the overall cost is £422,000 per annum. Now, I know that the grade is not, it doesn't mean the pay is 70,000, 73,000 per employee, because of some of these additional costs, pensions and so on, national insurance contributions, and you have put the figures in the report. But I want a fuller understanding of what that role, that person does in these 6 areas, and then I want to talk about the money. So that's the first question. Thank you.
Right, Rachel, do you want to respond?
Yeah, okay. So it's option 1 that's been approved. So I'm taking money first, sorry. Option 1 has been approved, and in that section it talks about, well, if all 6 posts are employed by the council, the maximum cost would be the 389,778.
Okay.
If they're all employed by the NHS, it's different. So it'll be a balance between the 2 with that, and they're topper grade as well. And as you say, that includes all on costs, national insurance, and pension, as I say. In terms of the configuration of the neighbourhoods, there are currently 9 primary care networks. So, and that was originally, we tried to map to all 9 primary care networks, and we just do not have sufficient resource to go to that level. So there will be a strategic footprint neighbourhood, one of the 6, which will support a few PCNs within it. The best geographical alignment is Farnworth and Kersley in terms of the PCN and the population, just for information, and I'm happy to share a link to kind of the configuration of the 6. In terms of the role, there is a job description attached, and the report does detail some of the role requirements within this in terms of section 4. So they are there to troubleshoot some of the co-location between the core partners on the ground, be located in the kind of the hub of where we'll have our co-located teams, to ensure the daily huddles happen between practitioners, to have a key role in liaising with the primary care networks in terms of the flow of kind of bringing cases through, and really ensuring that the leaders come together. So they'll have quite a fundamental role in terms of the collaboration between all partners and making the connections with the housing providers, the care providers, the police in the area, as well as your district nurses, your social workers, your GPs within there, because they very much are about creating that one team ethos, even though we'll remain employed by different organisations. So a lot of it will be about culture, some of it will be about practical things on the ground, and a lot of it will be about the networking and ensuring that the business and the working through kind of our systems processes, that we can align them and wrap our care around people as much as possible. But there is more information in section 4, and the job descriptions are there too.
Okay, thank you, Rachel. That was very good, actually. That's given me a really good insight as to the role of that person. I am going to focus on the money now, the funds, and this is important. And we had a meeting previously about the bins, and that I didn't think it was absolutely clear. So in my mind, I need to be clear about the finances here. We as councillors, when we bring something to the chamber, we're not able to bring any motions that affect the current budgets, but quite often when we have these meetings, we're told that they're coming from existing resources, and I'd like a clearer understanding of where those existing resources are, and also how they're going to be funded in future years, not just in year 2, 3 and 4, but as you suggested, it's a permanent post. How much is this council having to pay out of this £389,000 per annum, and where's it being funded from in future years? Okay, thank you, Rachel. Thank you, Chair, sorry.
No, it's fine, thank you. Right,
Thank
Rachel,
you.
do you want to respond?
I will, and Lisa can always chip in if need be too from finance. And this is a really important question, because actually this is probably a little bit more of an unusual report in terms of kind of the way in which the finance is set out. So the council will be responsible for a contribution to a third of the 389,000. In terms of, we have sufficient funds in our one-off transformation pot to see us through probably for about 9 months of the first year, from if they all become employed at the same time, probably a bit of slippage. What happens then, in terms of what you're asking, is the assurance that where's the money coming from and is it there? And so how I will manage that as a director is through vacancy management. So vacancy management of posts within the service. So I know that I currently have a post which is becoming vacant within the next 2 months, and with consultation with the exec cabinet member, I will not backfill that post, and the funds from that post will contribute to our ongoing cost. And I foresee that over 12 months, there'll at least be one other vacancy that we will review to fund this within that. So that is the approach we are taking from a council. The Foundation Trust and the ICB will take their own approaches, whether that's reviews or whether it's vacancy management or additional funds. But that is how we are managing it as a council. And I am confident that we already have half of the money identified for the longer term future, and the other half will come from existing budget through vacancy management of posts within this area.
I struggle a bit with that. I'm not going to take it further, but I really do feel that if we're committing ourselves to funding for something, that the budget should be absolutely readily identified, and as opposed to hopes for future roles or removing posts. I really do struggle with that. But I'll leave it there. Or I don't know whether Lisa wants to come in relation to my comments.
Thank you, Chair, if you don't mind. Thank you,
Yeah,
Councillor
to carry on. Yeah.
I mean, Rachel just described that really well. It is just the way that Rachel, as DAS, has a way of managing her budgets. So the money from the transformation pot is one-off. So that has been there for some time now, and we had all put money in towards it. Now, this is a really exciting opportunity, because from this is the first scheme or project that we've actually done that is going to bring down all 3 of us putting in money to do one thing. And the neighbourhood leadership is absolutely the thing we want to invest in when we talk about prevention, when we talk about communities, etc. So of the 389, we'll be paying a third, and so we'll be about £120,000-ish. Now, we do have vacancies within social care and within Rachel's budget. So although we're not committing to a specific budget, there is management of controllable budgets within Rachel's remit that allows us to do this. And I'm confident that moving forward, we will have monies available. And as soon as an opportunity comes around, we will make sure we firm up the budget for that particular area.
Yeah. And as I say, I'm really excited about the prospect.
It is
and
exciting.
the project. I think it's wonderful, and you know, it takes, when you say neighbourhoods, that takes a box for me. It really does. So I'm
Yeah.
excited, but it is just that concern. But thank you anyway. Thank you for the responses.
And to reassure you, Councillor Heslop, they are questions that I have asked before this meeting. Right, Councillor Morgan, sorry, you've had your hand up ages. I'm sorry about
That's all right, no worries. There were questions from Paul. There's only a couple of quick questions. I completely understand the rationale and absolutely do support it. It seems to be going on for quite a while now, but at least we're finally getting there. It's just with regards to the options and the way the report's written. Is the report suggesting that everybody else apart from Wigan has got onto the band 8 and L's? And if so, that means we're going to be we'll be paying, or we'll be on the lower grade. How confident are we of easily recruited to the posts? Because obviously the other 8 are paying a bit more than we are. And can you just talk about how the teams are going to be co-located and where, if possible, Rachel, please?
Okay, thank you. Yes, we are going for the lower band post. We had quite a debate about that in relation to would this detract? Would we be at a disadvantage? And I think what we've looked at quite carefully is the roles and responsibilities. So there will be lower levels of responsibilities in this post than, say, kind of some of the other posts hosted by other authorities. We are reasonably confident, but recruitment generally is a challenge at the moment. So we will have to go out and see whether or not we can recruit the right people with the bands that we've got. It is working successfully in Wigan in relation to that, but we're all very mindful of resources available to us, and that we needed to ensure that we gave this a try rather than putting in really senior posts, because once you get into the equivalent of an 8B, it's a senior post, and what we don't want to do is add additional layers of senior management where possible. In terms of the co-location, we're still working through the final details of the accommodations to roll out for the 6. We have the 3 main hubs, as you'll be aware, which are, they've gone out of my head now, Winifred Kettle is one of them, Waters Meeting and Pikes Lane. We then have kind of spokes off those hubs. So, for example, Farnworth Town Hall, we're looking at Horwich Public Town Hall being back up and running, and the other one in the north of the area, we're still working through just the practicalities of that before we communicate that out. But the final details of the co-location, so we have co-location in a number of those already, which is working well, and then we hope to, by April next year, be fully up and running in all 6 locations and hubs.
Thanks, Rachel. I appreciate it. Like I say, it's really quite exciting, and look forward to seeing it blossom and deliver what we're looking for it to deliver. Thank you, Linda.
No, that's fine. Is there anybody else would like to ask a question or make a comment? I can't see any indication. No. This is a 1-item agenda, and I think Rachel's actually spoken through the 4 recommendations at the beginning, so I won't repeat that because they are in the report. So I'm quite happy to support those 4 recommendations. I agree with Andy, I think, and Councillor Heslop. I think it's quite an exciting way forward, and I'm not unhappy that we've waited, because we've been able to sort of learn from other towns' experiences. So, you know, any pitfalls, we will overcome them. But it's really good working towards neighbourhood working again. I think this is really the way forward. So thank you for all your comments, and we'll agree the report, and that is the end of the agenda. So thank you very much.
Thank you very much. Thank you.
Thank you.
Bye, everybody.
Bye.
Thank you. Bye-bye.